Greetings, my name is Priscilla Sano and I am with Grand Canyon University. Today I will be going over one aspect of acid-base imbalances. And just to inform you, acid-base imbalances can arise from either respiratory or metabolic disturbances. So my focus today will be on metabolic acidosis. We will be covering a brief overview of the acid-base imbalance, causes for it, and also we will be covering compensations for the imbalance. So this is going to be the most prevalent cause for an acid-base disturbance. This acidosis is induced by everything other than acidosis caused by an increase in plasma carbon dioxide. In this instance, plasma bicarbonate is decreased and plasma carbon dioxide is normal. And that is one of the key features of metabolic acidosis, which is a decrease in bicarbonate and carbon dioxide will be normal. So this scenario causes an acidotic ratio of 10 to 1, and in any normal situation, we usually have a 20 to 1. At times, the body may be losing bicarbonate-rich fluid, and another instance in which we may be seeing metabolic acidosis is that it can be attributed to an increase in non-carbonic acid, in which bicarbonate is used to compensate for an increase in hydrogen ions. And just to key in on some symptoms for metabolic acidosis, patients may be experiencing headache, decreased blood pressure, hyperkalemia, muscle twitching. They will be undergoing vasodilation, so they will have warm and flushed skin. They will have some gastrointestinal issues such as nausea, vomiting, and diarrhea. And this imbalance can lead to confusion. And also another thing is that usually a compensation will end up leading to hyperventilation. So causes of metabolic acidosis will be diarrhea, diabetes mellitus, extreme or strenuous exercise, and renal failure. In the case of diarrhea, bicarbonate-rich gastric juice is going to be released from the pancreas to assist with digestion. In normal situations, this fluid will end up being reabsorbed into the plasma after digestion is complete. So severe diarrhea will cause bicarbonate to be excreted in fecal material and will not allow proper time for reabsorption. So we do have depleted reserves of bicarbonate, and they are no longer able to buffer the hydrogen ion concentration. Because of this, there will be an increase in the hydrogen ion concentration, which leads to a decrease in pH, and that ultimately will lead to metabolic acidosis. In diabetes mellitus, normal individuals are able to utilize glucose to produce energy with the aid of insulin. Since diabetic patients do not produce enough insulin, they are unable to break down glucose, and therefore their body will switch to breaking down fats instead. This will lead to an increase in ketone bodies, such as beta-hydroxybutyrate and acetoacetate from adipose tissue. The mitochondria will no longer be able to utilize the ketone bodies at such high numbers to provide ATP, and this will also be a situation where there is an increase in hydrogen ion concentration, and there is just not enough bicarbonate available to buffer those hydrogen ions, and that will also lead to a decrease in overall pH. Extreme levels of exercise. So during exercise, muscles are able to generate ATP aerobically through cellular respiration, but during extreme bouts of energy, anaerobic glycolysis will end up taking place. Glycolysis produces lactic acid, which does increase the plasma levels of hydrogen ion concentration. And this once again will lead to insufficient amounts of bicarbonate to buffer those increases in hydrogen ions. With uremic acidosis, we do have a situation in which patients are undergoing renal failure. So this will render the kidneys incapable of excreting amounts of hydrogen ions, and this is talking about normal amounts of hydrogen ions made as a byproduct of non-carbonic acids. So these hydrogen ions will increase in body fluids, and the kidneys are also unable to retain enough bicarbonate to buffer the increase in hydrogen ion concentration. Now, the kidneys are responsible for reabsorbing bicarbonate in urine so that we keep normal levels of bicarbonate within the water. But because these patients are undergoing renal failure, these kidneys are unable to do that as well. Now, a common treatment for uremic acidosis will end up being dialysis. So now we will be going into the compensations for this acid-base imbalance. So as repeated before, the normal acidotic ratio is 20:1, and that is compared to a 10:1 during metabolic acidosis. The body must compensate by reducing the amount of carbon dioxide and increasing the rate of bicarbonate. Now, going back to the carbon dioxide, if we are able to reduce the amount of carbon dioxide, even though carbon dioxide is normal in metabolic acidosis patients, that will help to decrease the hydrogen ion concentration. So the following will help to compensate for metabolic acidosis. So we have kidneys, respiratory system, and chemical buffers as well. With respiratory compensation, the lungs will compensate by hyperventilation. So even though carbon dioxide levels are normal in metabolic acidosis, we need to increase the output of carbon dioxide from the body. This reduced carbon dioxide will in turn reduce the amount of hydrogen ions, which will aid in correcting the pH partially. The pH cannot be corrected completely with respiratory compensation. For the most part, it will be able to correct it approximately at a 75% level. With kidney compensation, the kidneys may rid themselves of hydrogen ions and retain bicarbonate when there is no inherent kidney disease. So this happens in normal situations. In instances where kidneys are failing, they will not be able to restore pH completely. Uremic acidosis patients may not rely on their kidneys to combat abnormal pH values, and most of the correction will come from the respiratory system. But as stated before, the respiratory system may only correct it up to about 75%. With chemical buffers, sodium bicarbonate may be administered through an IV to balance the high levels of hydrogen ions, but this has to be done with care. It's used to combat bicarbonate loss in the body caused by some kidney inadequacies and diarrhea. So in review, we have discussed metabolic acidosis. Some key features with metabolic acidosis are that the carbon dioxide levels are normal, but bicarbonate may be decreased. Bicarbonate may be decreased due to the fact that we are losing these bicarbonate-rich fluids, or somehow there is an increase in hydrogen ions, and that leads to insufficient amounts of bicarbonate being able to buffer those large numbers of hydrogen ions present within plasma. We have covered a brief overview of the highlights of metabolic acidosis, causes for the acid-base imbalance, and also we have compensations for this imbalance. I hope this presentation has been informative. Thank you very much and have yourself a great day.